So MONARCH 1 was originally presented at last year at ASCO by Maura Dickler, looking at the activity of abemaciclib, our primary endpoint. And we showed at that time of the 132 patients who were enrolled that the response rate was 19.7%. That's an impressive response rate, almost 20% single agent response rate in patients who'd received at least one prior chemotherapy regimen. The majority had received 2, and then one patient received 3 lines of prior treatment in the metastatic setting. And in addition, 90% of these patients had visceral disease at the time of study entry, and they all had progressed on prior hormonal agents in one setting or another. None of these patients received prior CDK4/6 inhibition, which is important because this trial was done prior to most of the approvals that we have now. We also saw a progression-free survival of about 6 months on therapy, which compares favorably and maybe better than many chemotherapy options in the same setting in patients who've received prior chemotherapy. And 90% of our patients had received prior taxanes, which was one of the requirements of the clinical trial. So taxane pretreating metastatic disease, we saw a progression-free survival rate of 6 months and a response rate of about 20%. What we're reporting at AACR in addition is the long-term follow-up, of course, which shows similar results, and then overall survival, which is about 22 months. That also compares very favorably to what we see in patients who are starting first-line chemotherapy who have only a slightly longer overall survival in trials looking at taxanes in the first-line setting. So overall, it suggests that abemaciclib has significant single-agent activity, which is likely to be enhanced with the addition of hormone therapy. We've already seen in a press release from Lilly that the addition of abemaciclib to fulvestrant in MONARCH 2 resulted in a significant improvement in progression-free survival, and we expect that data to be presented at ASCO this year.